Hello and welcome into our Doctors In segment. We're here with Dr. Jack Schaeffer and we're talking to him about dry eye. And for a lot of us, when you hear dry eye, you think, well, it's just that. You have eyes and they're dry, right? But there's more to it.
There's a whole lot more to it. And again, this is one of my favorite subjects, and thank you for talking to me about it. You know, in medicine, we call it ocular surface disease, which ocular surface is the front of the eye. And when we deal with dry eye, we're dealing with something that happens to the front of the eye for lots of reasons we're going to talk about, but it's more than the eyes. It could be the eyelids. We know the eyelids are the cause of 80% of dry eyes are caused by the eyelids, not by the eyes.
So what are the symptoms of having dry eye?
Well, first of all, your eyes feel scratchy, they feel dry, they feel like you need to blink. And you know, people on computers all day, at the end of the day, oh my God, my eyes hurt, dry eye. You blink and your vision changes, dry eye. You're wearing contact lenses, at the end of the day, you say, I gotta get these out, dry eye. All of that are symptoms of dry eye. And as simple as you wake up in the morning, you get a little discharge out of the corner of your eye, you probably have a dry eye. And so the key is to find out what is the cause of the dry eye in this patient.
Okay, well, speaking of causes, so what causes it generally?
Well, it can be caused from anything, including systemic diseases, systemic medications, genetics, computers, contact lenses, fans blowing in your eye, and just not blinking enough, and especially things like rheumatoid arthritis or thyroid eye disease. There's many diseases we pick up because the patient comes in with a dry eye and we realize they have something really causing that needs to see their general practitioner or internal medicine to let's get the body straight, and then we'll deal with the eyes.
Well, can you determine if someone has dry eye by their first eye exam?
No, you cannot, unless it is so severe. And then you still need to have them back. You know, at Schaeffer Eye Center, we make this a point with all of our doctors. When someone comes in for an eye exam and we think they have a dry eye, you need to come back for a second visit so that we can really determine what is the diagnosis here. You know, what is the cause? Is it some systemic? Is it some from your eyes? Is it from the environment? What is the cause of this dry eye? And then you get the cause. Now you have to get the treatment. Now, development of treatment plan for dry eye is very complex. Never does one treatment work for dry eye because it's a progressive disease. It's an inflammatory disease, and it truly is a disease. It is a problem that's going to get worse. So you want to develop a treatment pattern that stops it and hopefully reverses it.
But the good news is there are treatments available, right?
There are so many treatments available. You know, the first thing we start with is just an artificial tear, but there's so many different tears. Which one works with this patient? Restasis, you know, you've seen the commercials, but Restasis is truly one of the only drugs that actually help you produce more tears. But if you've been on Restasis, it takes literally 3 to 6 months to work. And you may have to be on other things with it. At Schaeffer Eye Center, usually when we use Restasis, we start with a steroid first to quiet the inflammation of the eye, because that dry eye is an inflammatory nature. We want to quiet the inflammation and then move into Restasis. And at that point, you want to do other things. We have inserts that can go into the eye. We have something called LipiFlow. It's a great new treatment where we actually take the eyelids and drain the meibomian glands so that they can produce oil so that tears don't evaporate out of the eye. 85% of all dry eyes are evaporative, where the tears are evaporating because there's not enough oil holding the tears in the eye.
And is there a certain age group of folks that suffer from dry eye?
Well, we used to think people over 40 were the main demographic. We know now it starts at 20, it starts at 25, and we need to look at these younger patients and prevent disease. You know, in medicine today, we're always about treatment, not about prevention. And you know, the new medicine is going to be prevent the disease. Let's catch the disease early, and so there is no progression to late-stage disease.
That makes sense. For more information, head to SchaefferEyeCenter.com.